Hello, it's Bruce Williams again, and today I'd like to give you the final installment in my series on the selected gross pathology of non-human primates. And we're going to talk about the musculoskeletal system. Before I start, I want to thank all my friends and colleagues, as I always do, for providing me these outstanding images over the years as part of online collections or directly, which allow me to put these lectures together. I don't have a tremendous amount to say about muscles in non-human primates, but here's an outstanding image from Dr. Srini Rao showing massive sarcocystosis. Sarcocysts are seen in approximately 20% of wild-caught non-human primates, both Old World and New World monkeys. A couple of important species are Sarcocystus corti and Sarcocystus nesbiti, but these generally don't cause a tremendous amount of problem for the animal. They generally simply enlarge the myofibers with massive numbers of zooids, and if they rupture, you can have some local granulomatous and eosinophilic inflammation, but they generally don't cause much of a problem. Moving on to the skeletal system, here's a condition we've looked at in a number of systems. We're looking at a large amount of fibrin within a potential space. Here, the joint. And when we see fibrin in a potential space, I want you to think, at least for a moment, of strep. Strep commonly does this within the potential spaces of the joints, meninges, pericardium, abdomen, and pleura. And this is a case of Streptococcus pneumoniae infection in a young macaque. Streptococcus pneumoniae generally is passed to the primates from their handlers. We tend to carry Streptococcus pneumoniae around with us, and when we get stressed or the weather turns cold in the wintertime, we will shed it. The next image is very old, but it's not one that you come across very often. And this is an old image from what used to be Tulane Regional Primate Center, showing granulomatous inflammation and a pathologic fracture of the vertebra in a Rhesus macaque with tuberculosis. Rhesus macaques are extremely or exquisitely sensitive to tuberculosis. And if a pulmonary or lymph node lesion ruptures and gets into the bloodstream, it can go just about anywhere. It can go to the end plates of the vertebra, where the blood vessels have a particular hairpin shape, which makes it a great place for bacterial emboli to lodge. And over time, the chronic inflammation associated with this will result in weakening of the vertebra, and in this case, a pathologic fracture, spinal cord compression, and paralysis. This type of vertebral infection actually has its own name, and it's called Pott's disease across multiple species. Non-human primates, like man, are one of the few species that is unable to make its own vitamin C. It shares this lack of the enzyme gulonolactone oxidase with a number of other species, including guinea pigs, fish, and a few species of birds, among others. Many problems arise due to the deficiency of vitamin C, affecting a number of organs, including the hematolymphatic system, where it causes significant immunosuppression. But one of the most obvious manifestations appears in the musculoskeletal system. Vitamin C is an essential cofactor of lysyl and proline oxidase, which is important in the proper cross-linking of both type 1 and type 4 collagen. Type 4 collagen is an essential component of the basement membrane of vessels. And in affected animals, blood vessels, especially in areas of motion, will become leaky and hemorrhage. Type 1 collagen is important in bones, joints, and teeth. And so you will see significant issues in the areas especially of growing bones. Here we see hemorrhage at a point of motion, which is the wrist, or maybe a point of mild trauma, which is hemorrhaging more than normal because the blood vessels are leaky. A classic sign of vitamin C deficiency or scurvy, which is shared historically with people, is hemorrhage and mobility of the teeth. This was a classic sign in sailors back in the day who would sail across the ocean for long sea voyages before the connection was made to combat scurvy with citrus fruit, especially lemons and limes. This animal is going to have trouble eating, the teeth are going to be very mobile, and one of the things that is seen in animals with scurvy is pain. This is a classic lesion in squirrel monkeys. It has been seen a number of times in animals whose diets were deficient in vitamin C. And remember, vitamin C is a water-soluble vitamin that tends to leach out of feed over time, especially if the feed is kept in a very hot place. And in these affected squirrel monkeys, for one reason or another, they would develop large cephalohematomas from these leaky blood vessels on top of their head, and they would hemorrhage into the subcutaneous tissues, resulting in this very particular look. If the vitamin C is restored over time, these hematomas would often ossify, and you would have this really bizarre looking periosteal new bone growth arising from the skull of these squirrel monkeys. Cephalohematoma. Okay, let's move on to one of the most common problems associated with the skeletal system of non-human primates, and that is going to be a disease that goes by different names, whether the animal has open growth plates or closed growth plates. In the young animal, it's called Rickets, and in the older animal, it's called osteoporosis. Rickets, as seen in this young animal with markedly abnormally shaped and sized bones, is a disease of abnormal endochondral ossification in young, rapidly growing animals. It's characterized by a failure of mineralization of the cartilage and osteoid matrix, with subsequent deformity and fracture of the bones. Rickets can result from hypovitaminosis D and rarely from hypophosphatemia. One of the problems with New World primates is they cannot use vitamin D2 as their source of vitamin D and must have vitamin D3 in their diet. Of course, access to sunlight and activation of vitamin D3 to its physically active components, where it moderates the influx of calcium through the intestine into the animal's blood, is also extremely important. Too many owners of non-human primates will feed the animals what they want to eat and not what is necessarily good for them to eat, and may have absolutely no idea of this particular requirement. In the young growing animal, the lack of mineralization of the growth plate is required for breakdown of the cartilage and invasion of this cartilage by osteoclasts, which begin the process of remodeling bone. Osteoclasts are very picky, and they show absolutely no interest in unmineralized osteoid, which is very different from what you see in the growth plate of animals with vitamin C, in which the change in the osteoid due to the abnormal type 1 collagen prevents it from being mineralized. In animals with Rickets, they simply do not have the calcium available to mineralize. While you might think that the growth plate should be elongated all the way across at the same level, that's rarely the case in such cases, and it's often a very irregular retention of primary spongiosa. There is also some periosteal new bone growth in this area as the body tries to stabilize, and look how thin the cortex is throughout the length of the metaphysis and diaphysis that we can see in this particular animal. In affected animals, changes are often very prominent, resulting in swelling at the costochondral junction, which is essentially the growth plate of the rib. But remember, this has to be a young growing animal. This is not what you are going to see in an adult animal, but I'll show you what we see in just a minute. Classically, this has been called the rachitic rosary, a great descriptive name for this particular condition. Here's a great picture by Dr. Sesmeter Mishra, and this is a capuchin monkey that shows marked swelling, and the hemorrhage around the gums suggests that these teeth are very loose. Like horses, non-human primates, especially neural monkeys, can show marked deformation of the mandible as one of the earliest signs of nutritional hyperparathyroidism or osteoporosis in the adult animal. Because the body needs calcium to maintain homeostasis in the blood, as well as muscular and contraction of the heart, in animals that are not getting vitamin D or have very low phosphorus, low levels of calcium will cause the parathyroid gland to secrete tremendous amounts of parathyroid hormone and will suck all available calcium out of the bone, resulting in bones that are incredibly pliable, as we see here. If we look at the ribs, as we saw before, it was a line primarily at the costochondral junction. In the adult animals, you can see that there are multiple areas of swelling where most of the bone has been resorbed by osteoclasts to regain all of that calcium for other needs in the body. And there is fibroblastic proliferation. If you want to call this fibrous osteodystrophy, that would be a good use for that particular term. Histologically, this is what you see. The marrow spaces are much widened. There are a lot of active osteoclasts lining cells, and everything has been replaced by fibrous connective tissue. It's not just the bones of the legs and the ribs, but all bones will be infected. This is just a great old picture of an animal with nutritional secondary hyperparathyroidism, osteoporosis, or fibrous osteodystrophy, whatever you want to call it. And look how thick. It's probably 3 to 4 times the normal thickness of the cranium, and you have this sort of brownish red discoloration because the vessels, which normally are within the bone, are much more prominent than you would see in mineralized bone. Other names that you will hear for this disease, especially in New World primates, are simian bone disease or metabolic bone disease. A lot of names for a very important disease in non-human primates, especially those kept as pets. Let's finish up with arthritis. You can see in this joint that there is a marked loss of the articular cartilage. There are 2 main types of arthritis. That's There's that caused by abnormal wear and tear in age. And a second form, this is a good example of, which is called reactive arthritis, not only in non-human primates, but in humans where it's primarily seen. This is usually a somewhat non-specific, I won't say it's non-specific, but we certainly don't know the reason that it occurs. It is often a result of previous bacterial infection, often enteritis, and then the animals will develop arthritis. So this is the so-called reactive arthritis. And one of the ways that you can tell it from chronic arthritis in older animals and animals that were chronically caged, whatever, is the lack of osteophyte production. The articular cartilage is just starting to wear away. It's usually a very recent occurrence. And because cartilage, when chondrocytes die, they release a lot of, or while they're on the way out, release a lot of cytokines, which go and kill surrounding chondrocytes, and you have resorption of the cartilage. So cartilage, articular cartilage, because of its lack of a innate blood supply, tends to have a death wish, in my opinion. So once you get started with arthritis, it's really, really difficult to stop. Here's a great picture of degenerative joint disease, a chronic osteoarthritis from Dr. Nancy Cockett down at Wake Forest, showing the marked, there is some loss of the articular cartilage. It's certainly encroaching, but one of the changes that you see here is this tremendous periosteal new bone growth. Periosteal new bone growth generally starts at the area where the joint capsule attaches to the bone, so it's usually at the periphery of the bone. Anything that will cause increased tension, an animal limping, some pain, whatever, starts that proliferation, which further causes destability of the joint. But a great way to diagnose chronic versus reactive osteoarthritis is the presence of periosteal new bone growth. Just to show you one more, this very moth-eaten look with fissuring over the edges, but the joint capsule itself is very thick. Sometimes in these cases you'll see villus proliferation of the joint capsule, very fibrotic joint capsule, and the presence of these areas of periosteal new bone, which suggests that this is a case of chronic osteoarthritis, something that we do see in animals, especially in zoos, where they are often housed on concrete, and they live to much longer lifespans. They have a much longer lifespan in the zoo than they would in the wild, than they would in most laboratories. So you can see some really amazing cases of osteoarthritis. Don't forget that with something like this, systemic amyloidosis is not an uncommon sequela. And we're going to look in the classic organs for amyloidosis in non-human primates. The intestine, number 1, the liver, number 2, and then possibly kidney, lymph nodes, and other areas after that, including the adrenal cortex. Okay, well, we've gotten through several hundred images. I hope you've enjoyed this lecture series. I want to thank once again all of my colleagues for making their images available. And without them, I certainly couldn't do this. Look for other series on the gross pathology of domestic and laboratory animal species on the C.L. Davis Foundation Facebook and YouTube pages, and I hope everybody has a great day.